Hello, I'm Dr. Niesgoda, and welcome back to another edition of the Wound Care Window. We're here at AZH Center in Milwaukee, Wisconsin. Another interesting patient to share with you. Again, under the cloud of the COVID virus. So we had a patient that we've been working with for a couple of weeks, months now. Very difficult venous insufficiency ulcer. And she came in last week and looked like this. Now in this photo, you're going to see that there's a lot of fibrinous, sloughy material across her wound base. And this was debrided using an ultrasonic curette debridement. And it really lifted very, very nicely. And she comes back for a follow-up visit this week. And this is what you see. Really a nice improvement since last week. This speaks to the importance of debridement and removing that sloughy, fibrinous layer. But what I wanted to do today is some teaching, and we have just amazing talent here at AZH, very intelligent staff, and we're going to demonstrate that to you today. What you'll see is there's multiple colors and multiple appearances across this wound base. And so what I would like to do is some teaching here at AZH, and we use the Socratic method, asking questions and searching for answers. So I want to introduce you to my wonderful staff, Terry, Robin, and Jessica. So ladies, let's get a little closer here and take a look at this wound. There's a lot of different colors in the wound. We have some tissue that looks like this. Then we have some tissue that looks like this, and some yellowish tissue here, and then some areas of purple tissue. That's kind of interesting. Let's name the tissue, huh? So, Jess, what would you say about this tissue here?
Normal.
Normal color, normal appearance. Very, very different than what you see in the wound, correct?
Yes.
So, you should obviously know this red tissue pretty well. We call this what?
Granular.
Granular tissue, granulation tissue. And as you know, this granulation tissue is due to neoangiogenesis and the formation of new budding blood vessels. This is a really important phase of wound healing. Sometimes that granulation tissue will be covered by this yellowish material. And I already gave the answer, Robin, so I'll let you pick this answer. This is the stuff we removed last week, and I did a reasonable job, but obviously there's a little bit of reaccumulation, maybe some places that I missed. But what are we going to call this yellowish tissue?
Slough and fibrin.
Slough and fibrin, excellent. So if you look into the wound, you see these areas of purple color. What is that purplish discoloration? Is it bruising or bleeding? Do we put our compression on too tight, Terry? What do you think is going on here?
No, it's not bruising. It's granular tissue underneath with some new skin over it.
Right. And what do we call new skin, Robin?
Epithelium.
Epithelium, neodermis, right. Mm-hmm. So you're exactly right, Terry. We see the granulation tissue here. When it becomes covered with a layer of epithelium, a thin layer of epithelium, you get this discolored type appearance. It's not bruising, but rather you're seeing the granulation covered by a thin veil of the neodermis. And that is very translucent, and you can see through it. You can sort of see the red tissue, the angiogenic tissue, the granulation tissue peeking underneath there. Now, why is there a difference? Obviously, we see dermis here and dermis here. Why is there a difference in color? Robin, what do you think?
It's just the different layers of skin, different layers of growth.
Okay, and so what do you mean by different layers?
It has more layers on it.
That's right. So there's more layers of epidermis, right? And it's more mature, okay? So here you might only have one or two cell layers of neodermis, which again is more transparent or translucent. You can see through it a little bit more readily, right, than something that's a little thicker and more mature. Here, when you have full epithelialization and full dermal development, you can't see through it and see the granulation tissue under here, where this is very thin and you can see the red tissue underneath. Okay. So very good, ladies. Excellent. Intelligent people here at AZH. We spend a lot of time teaching. I think it's important that everyone in wound care is educated as they move forward. Doing something blindly and unknowingly certainly doesn't sit well for good outcomes, and so we try to educate everybody here. So I hope you've enjoyed this edition of the Wound Care Window. See you next time.